This is back on the Bossman show. A special guest, Dr. Gupta. See him on MSNBC. Today's show. I watched medicine. He's a lung doctor. I see you, doctor. He's a great man. He knows a lot about COVID. He'll help us out today in the show. Dr. Gupta, good to talk to you. I'm a big fan of your work, man. Thank you for helping us here in Atlanta today, Coach. You're a coach to me, coach of COVID, yes.
Thanks for having me, JR. I really appreciate it. Great to be here.
Dr. Gupta, we had the NBA All-Star game here in Atlanta. A lot of people came from out of town. So we're locally, we're scared about our numbers there because we have the variants here as well. A lot of people came travel here from out of town for the All-Star game. Now we're left here in the city to deal with the aftermath. So for our Atlanta listeners who have not had the vaccine yet, what should they continue to do for its measures to protect themselves against the variants and just being safe here, knowing that we had a lot of things here where our towners coming to town with different stuff from all over the country and outside the country as well?
Oh, thank you for asking that question. For all the listeners out there right now, please, for your own health and the health of your loved ones, whether you've been vaccinated or not, for the next 3 months, literally for the next 3 months until early June, I'm asking you to please just continue to act in the way that you've been acting over the last 12 to 14 months since the beginning of this crisis. That means the best quality mask you can find, ideally at least that blue medical mask, with maybe tying the ear loops so that you get that nice fit, minimizing your public activities, really avoiding indoor gatherings, especially with individuals, especially if you're unvaccinated, trying to congregating in indoor settings. Those are things you don't want to be doing right now because, JR, you mentioned these variants, because, frankly, we still have 60,000 cases a day.
Yes.
We just had 2,000 deaths. And I think we're getting numb to numbers that 12 months ago would have shocked us.
Yes.
And here we are thinking, well, things are improving. And they are, but we're still in the crisis. We're still in the middle of it. And so for everybody listening right now, we have a few more months to go until most of the country gets the vaccine. It's really important to remain vigilant because here's the thing. These variants can cause a problem here. If we start loosening mask mandates, if more governors go the way of Governor Abbott in Texas and sort of inexplicably say no more mask mandates too soon, then what happens here is that you have these variants that right now the vaccines are still effective against. All these vaccines, whether it's Johnson & Johnson or Pfizer, will prevent severe pneumonia from any of these variants. So that means it's going to save your life if you get the vaccine, any of them. But if these variants continue to spread out of control in our communities, they can continue to change. And if they continue to change and mutate and kind of build more defenses against the vaccines, then we have a problem. That's the concern here, is that right now we still have a lot of community transmission,
Yes.
60 to 80,000 cases. We have these variants. We don't want people to get complacent too soon. It's March. I'm talking June. That's it. And that every forecast suggests that by the end of June, hospitalizations and deaths from COVID-19 will be at their all-time low. We can really start talking about vacation planning. We can talk about a normal school sessions, semester starting in the fall, certainly normal holidays. Doesn't mean that we're not going to be impacted and have some PTSD from this whole experience. I bet some of us are still going to continue to mask optionally for a period of time. But for the next 3 to 4 months, vigilance is still required here. Because if we get this wrong, JR, there's a scenario where if we get this wrong, we're still experiencing 100,000 K plus infections
Yes.
into July, at least 1,000 deaths a day. That's a possibility. That's from our modeling here at the University of Washington. We don't want that. We want what we all hope will happen, which is normalization by the end of June.
Now, Dr. Gupta, for vaccines, I know I have the Pfizer vaccine. I get the second one on the 27th of March. Now, I'm in my 30s. So I know I had some arm soreness and body aches on day 2, but they've since subsided. So I'm trying to tell my listeners that it's okay to get the vaccine. There's no experiments going on here. I have asthma, so I don't want to die from this. So we have to be vigilant. In the black community, people of color, we have issues with health, our breathing problems, respiratory issues. We cannot be lackadaisical about this. We have to do this for safety purposes and to help us get back to a normal Georgia, even though our governor here went too early to make us normal, and it's still not really working, in my opinion, because hospitals in Atlanta and Georgia are still kind of up and down for me, Dr. Gupta, for us being kind of full with this virus.
Well, this is what I'll say, JR, and I'll say this as an ICU. This is me just putting my ICU hat on. Most of the people that I care for on life support with this virus, dating back to the early days of the pandemic, they're people from communities of color, Black and brown individuals. And I understand the reason why there's increased skepticism, concerns about vaccine quality and safety in BIPOC communities. I get it. I understand that there's historical reasons for that. It pains me, though, that when I see uptake vaccination rates amongst BIPOC communities versus Caucasian communities, that there's such a discrepancy, because the communities that are being that I'm caring for, that are being affected disproportionately, are individuals from BIPOC communities. They deserve, if you ask me, we should have prioritized individuals from those communities. That should have been part of the CDC ACIP guidelines, that if you're a member from one of these communities and you're high risk, you should be at the front of the line, because people from your communities are dying disproportionately. I'm putting them on ventilators. So please, for everybody out there, I mean, there is nothing to fear about these vaccines. What you should fear is contracting this virus.
Yes.
And the impacts this virus potentially could have on your lungs, and the risk that anybody, I've cared for 18-year-olds and 80-year-olds on ventilators dealing with COVID-19 severe impacts from this virus. That's exactly what any of these vaccines protect against. And I'll say, JR, I actually think our messaging on this from the highest levels has been very confusing. When it comes to vaccination, we are talking way too much, in my personal opinion, on things that don't matter when it comes to vaccine effectiveness. We're saying Johnson & Johnson is 64% effective against this virus and Pfizer's 95%. That's just nonsense. Johnson & Johnson is 85% effective at preventing severe complications from COVID-19. That means resulting, and you know what? It was 100% effective in keeping people out of the hospital, and 100% effective in reducing deaths to zero. The same as Pfizer,
Wow.
the same as Moderna. Why are you going to take a vaccine to prevent sniffles from COVID-19 or body aches from COVID-19? No. Who takes a vaccine to prevent mild symptoms? I don't take a vaccine to prevent sniffles. I take a vaccine to keep me out of the hospital. And that's exactly what Johnson & Johnson does. We should be talking about the things that matter with these vaccines, not silly numbers here that have no clinical meaning. It doesn't help anybody. And all it does is cause distrust amongst communities that already are distrustful. And here I am saying, as a doc, I just want to keep you out of my ICU, and so that you can live a long, healthy life. That's the most important thing. I think media outlets, I won't name them, but media outlets, and certainly I think our messaging at the highest levels has been very confusing on this, because everything's getting litigated in the public. The vaccines are safe and effective. They will keep you out of intensive care. They'll keep you out of the hospital. They'll let you live the life you deserve to lead.
Dr. Gupta, that's why I got to shout myself out, Dr. Gupta. I want to be a leader for my community, because me being in my mid-30s, I have a listenership base here from Chattanooga to Macon, Georgia, Dr. Gupta. I decided I have to do this for my community and be an example that, yes, it's okay. And I want people to be safe, because I've lost 8 friends, Dr. Gupta, from this virus, who I loved, from 24 to 49 who've died from this. And I don't want to lose anybody else. And I don't want to join the number either. So I've been very safe. I haven't been out to restaurants since March 14th of last year. My birthday is tomorrow. So I have not been out in over a year since then, So I'll take this very seriously. I want people here in Atlanta to be sick, because Dr. Gupta, we have people here who go out to clubs with no mask on still, go to malls. And I'm just like, this is not good. We have clubs promoting events. And I'm like, this is terrible what we're doing here. And I want you to, on the show, I want you to tell our listeners here, our people here in Georgia, we cannot be this just do this. We don't want to die, and going to the club is not worth it. You should want to live a life and be there, have a go to the club years from now. You do that, but to go to clubs and go to parties, go to hookah bars, go to restaurants and dine inside and get the virus when it's going to be floated above your head, it makes no sense to me, Dr. Gupta. But people are doing it here. Then they wonder, oh my gosh, so listen. Well, we try to tell you on this show, after this show, I tell you, you try to tell people as well when you go on TV as well. People realize this virus will kill you. Do not let the people who out there who are anti-maskers get you sucked in, and then you get sick and you have a lungs that look bad. I saw your picture you posted on Twitter. You don't have those bad looking lungs that you posted. You want to have healthy lungs you can breathe in and be healthy and have a great life and a great family and go old with your grandkids.
Well, and thank you. You nailed it. There's a few things there that let me amplify. One, I have cared directly for patients who were exposed unwittingly to the virus from a family member who, say, traveled for the holidays and then brought the virus back into their home setting. Or, and in many cases, those are young people who weren't trying to harm their grandma or granddad or their parents, but didn't follow guidance, went to a party, thought it would be okay because, they thought they were young and they would be okay. And yes, they were fine. But you know what? Who wasn't fine was the individuals that they exposed. So it is real. We're going to lose probably upwards of 650,000 people, largely preventable because, the right behaviors and the right adherence to guidelines would have saved most of those lives. You can save the lives of your loved ones, all your listeners out there. You can save the lives of your loved ones, your vulnerable loved ones, if for the next 3 months you just continue to buckle down. It's in the grand scheme of our lives, it's actually a small price to pay at this point. We have a vaccine. It's on the near horizon for all of us. If you haven't already gotten it, normalcy will be here soon enough. The question here is, how many additional Americans will we lose?
Yes.
How many are we willing to tolerate additional losses of life lost to this virus? How many are we willing to tolerate? That number can be as small as 60,000 additional lives lost, or it could be 130,000 lives lost, purely depending on our behaviors. That's one. Two, I will say there's a lot of people out there who get a kick out of being contrarian, who say, you know what? Everybody's masking. I'm not going to mask. Everybody's, you say get this therapy. Well, I'm not going to get it. You say get the vaccine. I'm not going to get the vaccine because there's a fad to be contrarian, to get followers, or to be provocative or controversial. That's nonsense. Listen, we all just want to get back to our lives. Yes. and plan. And the quicker all of us just fall in line, the quicker we can just start going on vacations unmasked, go and meet up with family and friends in restaurants and bars, hopefully have some of the restaurants that close open up again. I mean, we all want these things. We're all sick of this. But the contrarians amongst us who get a kick out of it, personally annoy the heck out of me.
Same
because
here.
All they're doing, they're just being controversial to be controversial. Ignore them. They're not helping anybody. They're just trying to help themselves. Focus on what you can do to protect yourself and the health of your loved ones if you think you're invincible. Because let me tell you right now, many of us in healthcare have cared for people on life support who've been unwittingly, again, exposed to this virus by younger individuals in their household or family members who thought they were invincible and went and partied, went to the hookah lounge. Don't do it. It's just not worth it. It's not worth it in the long term.
Dr. Gupta, thank you for your time today. We'll do this again real soon because I enjoyed this. I want to get you on and talk to my listeners here. I want to save as many people as we could because I want people to live and not die, Dr. Gupta. So thank you for helping me today do that. And I want to do this again with you down the road for sure, my friend. Thank you so much for your time today.
Thanks for having me.
Anytime.